Well, good evening, everyone. I'm Alex Trianis, Dean of the Johns Hopkins Carey Business School. It's my pleasure to welcome you to the Carey Business School Distinguished Speaker Series. Through our Distinguished Speaker Series, we bring to you the most accomplished business professionals to discuss today's most compelling business challenges. And today, we've assembled a panel of senior medical executives from 3 Fortune 100 companies. Joining us is Dr. Marlise Barber, Director of Health and Wellness and Chief Medical Officer at Lockheed Martin, Dr. Victoria Weldon, Global Medical Director for ExxonMobil, and Dr. Lori Zimmerman, Corporate Medical Director for Citigroup. Each of our guests has a somewhat different role within their respective companies, and they work within different industries. However, they share the important responsibility of ensuring the health and wellness of the employees of their organizations. Although the focus on health in the workplace can be traced back to at least the 1700s, the chief medical or health director role is not as well known as many other senior roles in large organizations. Not every large firm has such a position, but it's a growing field, particularly in the time of the COVID pandemic. In the past year, Tyson Foods, Royal Caribbean, Constellation Brands, and Salesforce were among some of the very large firms hiring chief medical officers. And the Financial Times just this past weekend published an article about the growing importance of the CMO or Chief Medical Director role at major corporations. Chief medical officers must be ready to lead the organization through the dramatically changing landscape of health and wellness within business and society. So I'll start our discussion by asking each of our panelists to take a few minutes, 4 or 5 minutes, to introduce themselves and explain a bit about their journey to become a senior medical executive within their Fortune 100 organization and how the position has evolved over time in their company. After that, I'll follow up with additional questions, but we're also anxious to hear questions from our audience. So please submit them using the Zoom Q&A button at any point in time at the bottom of your screen, and we'll get to them during the second half of the discussion. So I guess I'll go alphabetically here. Marlise, if you wouldn't mind starting us off and giving us some thoughts on your career and your role at Lockheed Martin.
First of all, thank you, Alex, for the warm invitation, and to the audience. It's really exciting to be here to speak to such an esteemed institution, and I'm certain that at Johns Hopkins, you work really hard. Just a little sidebar, I was briefly a resident in anesthesia at Johns Hopkins. And after a few months, I realized that I liked my patients mostly awake instead of asleep. And I decided to go back into internal medicine. But I did enjoy my brief stint there. I am, in fact, an internist, trained at the University of Rochester for both medical school and in internal medicine. And I was fortunate enough to fall into occupational medicine. I didn't know a lot about the discipline when I was training. We didn't have a very big school of public health that emphasized opportunities in this field. But what led me there initially was I also knew that I didn't want to be an inpatient physician. And at the time, it was just before the roles were beginning to separate. I came along in the days when the doctor actually had to see patients in the office, and then after a brief dinner, go in to see and round for his patients at night. And I wanted something a little differently. So I took an outpatient occupational medicine role in a clinic in New Orleans. And it was one of the most fascinating experiences because I treated people who worked on the river, the longshoremen. I saw teachers and firemen. I saw executives. And each of them had very common themes. The goal was always to get them back to work, but there were various reasons why it might have been a challenge to return them to work. For some, it was the severity of their injury. For others, there were often internal management issues that were a challenge. And that was the first time that I actually got a chance to work with externally people in human resources. I didn't know what human resources was when I was in medical school. 5 years in, I got an opportunity to apply for a corporate medical director's job. And my first one was actually with Lockheed Martin in New Orleans. And there I was a site physician for about 3,000 people We made the external tank for the space shuttle. And I would say the site was very much like my private practice. I treated them for work-related injuries, but because of the area of New Orleans it was in, I was always also much like a primary care physician. A couple of things disrupted that stint. There was a hurricane that you might have heard of called Katrina, and it had a very devastating impact on that site, and an unfortunate shuttle accident. At the same time, however, with this particular field, I realized that if I wanted to rise to the highest ranks, that I needed broader business skills. I had some concept of how organizations operated, but I didn't feel like that I had a firm enough foundation. And I pursued a master's in healthcare management at Harvard. Afterwards, I was then able to move into the role that I have now with a brief stop, a 3-year operational role with John Deere in a similar capacity. In that role and in this one, I'm responsible for the employees all over the world. At Lockheed Martin, we're around 100,000. And the scope of my work is, of course, any occupational illness and injuries. I don't treat them personally anymore, but I oversee a network of on-site clinics where our employees can come for primary care and urgent care, as well as any work-related matters. I'm also responsible for building the well-being strategy and implementing it. I'm a part of the crisis management team, and I think I can probably speak for Lori and Vicki in saying never before has that crisis management piece been in such demand. The pandemic made us all feel like we were residents again, but it's a fascinating place for a physician to be. I can't imagine now that I've had the opportunity to work in a large organization how I could have thought of being any other type of physician.
Thanks so much, Marlise. And we'll follow up on the broader business skills that you mentioned a little bit later in our discussion. And
Sure.
I imagine that your reference to being a resident again means that you haven't had a lot of sleep over this past year.
That would be correct.
Great. Well, Vicki, we'll turn to you now. If you could talk to us a little bit about your career and about your current role.
Yeah, so interesting to hear Marlise's. I've known you for a while and I didn't know some of those details. So that was very interesting. I'm also an internist by my initial training. Really, just like Marlise, kind of happened into the field of occupational medicine. It is not well known, at least at the time when we trained, it was not well known, and I'm not sure how well known it is now either. As a field, because it's a small field, and so it doesn't tend to get a lot of emphasis. But I initially went to work right out of my training at a refinery, and did it primarily to have a stable job while my husband's surgical practice kind of got started up, because there's a lot to do in starting up a practice back in those days. And after a few months, I realized that I had just sort of lucked into an amazing turn in my career that I never expected to have. And for many of the same reasons that Marlise said, because it's absolutely fascinating to be kind of at the intersection of where people's health it can be impacted by their day-to-day life, where you actually can do some proactive things to help people manage that. And you're dealing with people who are very motivated to stay safe and healthy. So it became a sort of a change in course for me after having planned very carefully every aspect of my life up until that point. It was sort of just a sudden change. But kind of started in at entry level, which many people in this field do. There's a lot to learn and know, particularly about the workplace, and particularly if you're working in an environment where there's dangerous environments that you're trying to coordinate with safety, with toxicology, and managing those aspects. And so did that for many years, and then kind of just gradually, I've been with Mobil initially, and then ExxonMobil after the merger for my entire career. So I've been with them for 26 years. And one of the amazing things about working for a large international company is the breadth of opportunities that you have. because I never imagined as a physician that I would be flying to places like Chad and Cameroon and Papua New Guinea and going to visit work sites and talking with the workforce there and assessing kind of what they needed for us to be sure that we kept them safe and healthy. And so I've had progressively increasing positions with increasing scope and work. And kind of much like Marley said, I don't so much see patients anymore, although that was a fabulous part of my career. I now do a lot more managing through other people and managing our own clinical services. So we deliver a lot of the health services to the workers in many locations. But in other instances, we do assessments and we use third parties and get involved in just sort of determining what we need, what type of services we need. So there's gradually been more and more business component to what I do. And I think that's another thing that's interesting. I enjoy diversity and change. And, had I gone and done sort of a more standard doctor job, you go in and out of a patient rooms day in and day out. Our days are the variability is incredible, and we interface with so many people, and we're doing technical work and we're doing business, we're doing advocacy, you name it, legal issues. That it's the whole gamut, which for people who enjoy variety, that's just the best. So I look at my job as having gotten better every year. So that's kind of where I'll leave it. I'll hand it over.
We'll talk if it's gotten better every year, including this past year, a little bit later.
In a weird way, it's been good this year.
We'll dig into that a little bit. Wonderful. Thank you, Vicki. So Lori, your company, obviously, Citigroup, is a little bit different, not as many industrial type of risks, but obviously a massive global company. So if you could talk to us a little bit about your somewhat different role and how it works at Citigroup.
Thanks, Alex. And it's interesting to hear Marlise's and Vicki's story because mine is not that much different. Traditionally, I'm also a board certified internist. I, was one of these individuals who from the time I was 13, I knew I was going to be a doctor, went to college, did my residency. And when I finished my residency, which was very similar to Marlise's experience, all of it was inpatient. So I had very little exposure to outside of the hospital setting. And when I finished my residency, I was sort of at a crossroads. I didn't think I wanted to do a further fellowship, and I didn't have a plan. And it was interesting. I sort of found myself for the first time in 15 years without the next step, because in medicine, you're always thinking about your next step in training. And I happened on a few little odds and end jobs. And then my first job, and truthfully, my last job, was at Citi. So I've been at Citi 31 years. I similarly started when they opened up an additional medical clinic in an additional building that opened, a building of about 5,000 people. And I was the on-site doctor for employees who became sick during the day. And one of the, I guess the beauty of the job was I had time to learn, I had time to develop relationships, I could focus on education. And I found that I sort of blossomed there because it was so different from my training, which was very, without saying my age, it was the time of AIDS. And, that I was an expert on AIDS because everybody who was in the hospital was really dealing with either end-stage cancer or AIDS at the time. And so I really had very little outpatient experience. And I found that I really loved it. And over the 31 years, my role has expanded beyond my wildest dreams. And I think exactly what Vicki said, there's never a boring day. I'm learning every single day. I'm challenged every day, but our role has increased. And I think that, I've moved from an on-site medical doctor to an associate medical director covering the New York tri-state area to national to global. And I've been in my current role about 10 to 12 years. And I've seen the role of, and the importance that we play. I too oversee on-site medical clinics. We have 8 medical clinics in the United States. Very different probably than Marlise and Vicky's, because we are not dealing with occupational exposures or hazards. So a lot of it is, you know, you get a cold at work, you get chest pain, you get strep throat, you have a urinary tract infection. And the idea that employees could come down, be seen by a healthcare professional, be treated, and 90% of our employees were able to go back to work. So my whole frame of work, of reference from being in the hospital, and very valued. And I think Citi has had a long tradition. We've had medical on-site for years, well before I've been there. It was just part of the DNA of the company, but the role has changed. And I think we've always been in this crisis management part of the team. And now we're sitting at the front of the table because we're all learning. And it's really been, I don't think any of us could have prepared for this moment in time that we've had over the last year. We've dealt with sort of episodic crises, but never a crisis that's happening at the same place all over the world. And it is similar to residency, probably harder because we're learning. And I think, we have to be very agile and have to constantly be the smartest person in the room, or at least know who is, and be constantly being, we defer to Johns Hopkins, we use all their metrics, to help guide our decisions of whether we pull back, whether we retreat, whether we re-enter. So it's really been a great partnership. And I think that's something for me that there really hasn't been a day that I haven't loved what I've done. And similar is that nobody really knew what we did until now, internally as well as externally, and just the role that we play and the trust that we have from our leadership has been, extraordinarily rewarding.
So Lori, thank you so much. And I think that's a great segue to where I want to head next, which you've already previewed a little bit about this past year and how things have changed for the role. And you used, words like partnership. I think I'd kind of like to explore how you see that changing. Will that continue going forward? Has this kind of reset the importance of the role? You've become closer partners. The value of what you do is more appreciated in the organization. So if you could comment on sort of your thoughts on any of those, and any of you, I'd really appreciate it.
I'll certainly start, and I'm sure we have similar stories. I think that for Citi, our roles, whether it's the health and well-being of our employees, has always been a priority. But I think it's been raised to now it's not a priority, it's an essential. It's key. And I think the pandemic has shown, just the vulnerability of all of us, in terms of how do we manage through this. What I'm very encouraged about is that I have a seat at the table where that wasn't as common in the past, where I'm part of a decision-making team. I was always a key member, but it was never at the scale now that it is now. I think that this year of really pushing employees to the brink of working extraordinary hours with tremendous stresses, balancing life, family, illness, etc., we really have to focus on our employees. And so I do think that the role, this isn't a temporary role. And I think by your introduction of other companies seeing that this is valuable, and I sit on a number of sort of financial medical directors, and there are some companies that don't have that. And I think they are they're challenged in their response.
Thanks, Lori. Marlise, Vicki, would you like to add to that?
Sure. I'll just say that, well, first off, I started my job as medical director on January 1st of 2020, right when the pandemic was starting. So it's really kind of defined my role at this point. Of course, as I said, I've been working with the company for a long time, but that's when we had I like to tell Dina, who was the previous medical director, she had perfect timing. Like she retired just before the pandemic started. But what I would say is that it has changed the way this job is viewed, and it's given me an opportunity to really be more than just the doctor. So in the past, most health issues from an occupational health standpoint are about preventing kind of long-term health effects. And we kind of were a mature organization, and much of what we do is contained under privacy laws. So we're sometimes not well understood. They knew we did our jobs well and that, but what's been for me a great experience is to be able to sit side by side with senior management, and they've been very engaged, and all the other functions, HR, finance, you name it, everybody. We've come together for this emergency, massive scale, and I've been allowed to be more than the doctor. So they've been able to see my logic, how I approach problems, and really have now invited me into other meetings that have nothing to do with medical, but to say, hey, we want some cold eyes, like this is this problem we're facing. What do you think? And here's how we're going to present it. So it's kind of allowed me, sometimes when you're in the field, they would say, like, stay in your lane. It's kind of allowed me to move outside my lane sometimes, and I like that because I feel like I did not check my brain out for everything else the day I went to medical school. So it's been another part of, I think, the growth of my career, and my really just kind of helping the company see how people who are in this position can contribute. So definitely it has evolved in this last year, and it's allowed us to showcase some of, and it is really not just me, but I mean, my entire team throughout the whole globe has really helped the company with their business continuity by developing strategies and plans that help them stay up and running safely. And so, across the board, it's giving everybody in our organization, an opportunity to shine in a time of crisis.
I'd like to build on something that Vicki said, which is about being pulled into other conversations. That's probably happened to a certain degree with all of us. And one of the things I think that business leaders are recognizing is that physicians' skills are uniquely suited to be excellent advisors in a business environment. We are trained diagnosticians, so we know how to look at a problem and carefully dissect it and find the risk and develop a differential diagnosis of, could it be one thing versus the other? And we have a methodology of ruling things out. And I think that makes us very keen observers. And because we are also trained to listen and to observe in order to make diagnoses, that's another important skill in business, to be able to sit back and survey the room and recognize what the priorities are without sometimes them even being stated. I think we have an advantage in that area. And just to give you a little bit of information about what a typical day for us might be like, I wrote down some things that happened in one day. So I came in and I immediately start with emails from overnight from international colleagues. And I had an issue with a contingency from Denmark coming in, and they wanted to know if we had relaxed the quarantine rules, or if we were still requiring a 10-day quarantine before they could come on site. So I had a quick chat with that group, and following that, there was a meeting on facilities because, as you know, many of the COVID restrictions have been lifted. We've spent an extraordinary amount of money on cleaning supplies in the company. And one of the questions, not a suggestion, but one question was, do we still need to do the high level cleaning for every COVID case that we have now that we know more about COVID and it's not as associated with being passed by touching? After that, I had a vendor meeting as to whether or not we would offer an app called Sleepio, which would really help our employees during this stressful time with managing their sleep or anxiety. And then I had a diversity and inclusion conference to talk about work-life balance and how people are managing working remotely and the impending stress around what return to work will be like. And finally, there's always someone asking, when is one of my sites going to catch up on their medical surveillance exams? Because we have production people and we really had to change our operations with COVID. We had to stop doing a number of tests because they were more hazardous to perform during COVID. An example would be spirometry, where you have to blow into a machine to assess the lung capacity. And we stopped those, but by our OSHA regulations, they are required. So we've had to jumpstart all of those things again. So as you can see, they run the gamut all in one day. These are just from room to room and very interesting.
So very interesting. Just as a comment, that sounds exactly like my day, with the exception of the last one. And we do use Sleepio, and it's a wonderful product. And it's really been a behavioral health tool for our employees to help with sleep.
Oh, good to know.
So it really is. We can talk to you about that, but very similar.
And I do want to get back to sleep. That doesn't sound right, but you know what I mean. A little bit later in the work-life balance. But before I do that, you talked to Marlise a little bit about cleaning and how much cleaning is required. And so, you know, we have a tendency, obviously, in business to focus a lot on costs and on ROI and creating value for the shareholder and so on.
Mm-hmm.
And one thing that obviously we've learned over the last year, not just in healthcare, but even in areas like supply chain, where prevention and mitigation are not always valued. The companies just don't want to spend money, or governments don't want to spend money on things that aren't used most of the time, right?
That's right.
So I'm just kind of curious how, from a strategic perspective, you have discussions with other chief officers in your companies about the value, about the right framework or paradigm they should be using in terms of thinking about investing in health and wellness of their employees. If it's not ROI, what is it?
I'm going to ask my colleagues to weigh in on this, but I think most of us probably start with a risk-based framework, which things will cause either most physical harm to employees if they aren't addressed and or funded, and also reputational risk, because one of the things most large companies don't want to happen is to have an incident with either a product or a report of having an unsafe workplace. Those things are never challenged. So we always get funding around safety and reputational risk. Where it is more challenging and you really have to have a stronger business case is in more of the well-being realm. And I think COVID has helped in at least making it more personal to leaders and employees at all levels of the corporation. We all went through a disruptive period and had to re-engineer our lives. Now everyone understands what it's like to be stressed. Everyone understands what it's like to have to find alternative arrangements for kids. So we have to know when to seize the opportunity. And most of us will probably not let COVID get by without asking for some of the things we've been longing to have in well-being for a while.
Thanks, Marlise.
How about you all? Is your approach any different?
I'll start. I mean, I think very similarly that COVID is an inflection point for the importance of the health and well-being of our employees. I would rather not have gone through COVID, but I think that's going to be the silver lining, that it will be key. And I think it will be much less challenging to present the argument of why it's so important that our employees are physically and mentally well. We've always had that as our mission statement, improving their health and well-being, but now I think we know it. And I think where, Vicki and I were talking earlier, we have been fortunate enough that we haven't had to show a return on investment, and prevention is hard to show, that it's valuable. But I think we all know that the dollars and cents of sick employees or people who are present but are not productive cost the company ultimately money or turnover and things like that. So I do think that the employee well-being is going to be front and center. And I certainly am at the table now with human resources, which I too did not know what that was. And I didn't know what managing director was. And I thought there were so many doctors at Citi until I learned that that's another title. So it was just very funny, just as knowing your lane. But I'm very optimistic that that is going to be a priority going forward. And I think the workplace is going to look different because of that. I think we're going to have more flexibility, and people are going to, whether it's taking time to exercise, figuring out how to do that. And when you're not always on site. And I think it's going to also be very different in how we deliver our programs. We've been very site specific, whether it's our on-site clinics, whether it's our on-site health promotion programs, our health screenings, our skin cancer screening, our flu shots. We had to think about different ways to deliver them this year. We did drive-through flu shots at our large campus locations, and we invited our employees and their families, which is something we'd never done because we didn't want to bring them on site. But we also don't want to, I think the importance of prevention is going to be very key. We've always done biometric screening and we have huge participation. We have to think about how do we deliver that remotely, either, at home testing or things like that. So lots of creativity, thinking out of the box, but I'm very optimistic that our roles and the importance is going to be, front and center.
I'll just add that I think one of the values that a chief medical officer can bring is to have some expertise in how best to spend dollars on in the area of health. So, health and wellness is a huge industry, and they do a great job of advertising, and everything sounds wonderful. And without having, people who can kind of sort through what the real needs are and what the value is of certain services or products or you name it, you could actually spend money wastefully. So I do think there's an aspect where having someone who can help navigate that space can be a cost saving for the company. And we follow, much like Marlise described, a risk-based approach. So there's things that are required that you're just going to have to do them. It's a matter of how do you do it? What's the most efficient way to do it? There's other things that we call business justified, whatever, because of the way your business is. There's certain things that make sense to do for your employees. And then there's things that are just more purely discretionary. And we kind of divide them into those three categories. And then we have, very transparent conversations with the businesses about, this is where these services land. This is, if make your choices on what makes sense, but at least make an informed choice. And that's kind of what we view our real mission is to help them make informed choices about what they choose to do or not to do.
If I could add, I think it also makes a difference which industry you're in.
Yeah.
If I look at our colleagues at J&J and even some of the tech companies, there is, I think they have an easier time making a case about discretionary spending around some of the in the well-being trend space. It's much more difficult as a defense contractor to justify something that isn't going to clearly show that it's decreasing absenteeism or improving presenteeism.
Yeah, and Marlise, I'm glad you brought up presenteeism as well. There have been studies that have shown that, presenteeism, if I can define it as a layperson, probably not all that well, but those that are actually present but are not productive at the level that one would expect and not collaborating with others as they should. And that's obviously a hard thing to measure. And as you said, it's hard in particular, as I'm sure as a government contractor, to try to get reimbursed for those savings. What I'm curious, how do you view sort of presenteeism in the broader context of well-being? And we did the shout out, I guess, for Sleepio, if I remember the product correctly. But what are the gamut of solutions or product services that you're trying to provide, either your own or through third-party vendors, that you're trying to provide for your employees? What do you currently sort of recommend and implement, and what might you wish that you had to help your employees that isn't around there for the entrepreneurs that we have in our audience?
Mm.
Well, we created what I now refer to as a platform in our company about probably about 12 years ago. And we call it culture of health because that's what it is. We're trying to create a culture of health in the workplace. And the reason that I think it's been successful and that it has moved from what I think is the company would consider discretionary to something that's part of the fabric of who we are is that we called it exactly that. It's a platform. If you have health issues that are unique in your facility, your location, we'll provide the solutions to help address that. It's flexible. We do centralized planning. We created a lot of toolkits of various different things, whether it's fatigue, whether it's sleep, whether it's back pain, all these things, and so people can pull from these toolkits, do work site programming. There's things available for employees. We've done things like allowing people to providing coaches for people, like health coaches. We do a lot now in the mental health resilience and care space because that's really needed right now. But it's a platform that allows us to say Culture Health will be doing a program on this. And rather than calling it, this is, the health and fitness program, we called it our wellness platform, and it created much more flexibility and I think more durability as well, so that it was easier for the business to understand how they could utilize it and how it benefited them. So as an example, at one point when the finances were a little bit tighter, it would have been easy and historically might have been the case that they would have said, we need to cut budgets, that all that discretionary stuff's going to go away. The feedback I got was, we can't let this go. Our people need this now more than ever. And so that's when I kind of knew there was sort of a turning point. This was even before the pandemic, in my opinion, that it was sort of a turning point where people understood the value that it brought for morale, for employee retention, recruiting. Certain locations, it's actually considered, a benefit in recruiting. They people want to know that your company cares enough to offer this type of programming.
So I'll just, lead on from where Vicki left off, and very similar approach. I mean, we had a similar situation with the financial crisis in 2008, and it was very interesting at that time, where a lot of cuts were being made. They made a very conscious decision not to touch any of the budgets for health and wellness. We didn't expand during that time, but we kept things going, which I think was an extremely important statement for the company. We too focus on a brand, and all of our programs that focus on health and well-being are called Live Well at Citi. So everything falls under the same brand, and that's globally. So whether you're doing a health promotion program, whether you're doing a biometric screening, whether it's your employee assistance program, it all falls under that. I would also say mental health offerings being consistently offered across the globe is another key initiative, and making sure that all of our employees have access. We actually, during the pandemic, we increased our session model it was a 5-session model to a 10-session model, and people were using that. So, the idea of removing roadblocks and making it easier for people to make good decisions, enhancing our offerings through Sleepio, offerings through something like Talkspace, where people could, talk to a therapist. Pre-pandemic, we did a lot of on-site programming, and we had a global fitness challenge, which, we encouraged our employees to exercise at least, 3 times a week, 30 minutes a day, and they tracked it globally, and it was correlated with donations to charity. But I think all of these things, I think the brand is really important. So there's a recognition. It has to be authentic. It has to come from leadership top down, even if the leaders talk about it, but if your call center employees can't take advantage of these programs, the message is lost. So it's sort of top down and bottom up, and understanding, and I think the pandemic has made it even more important. We have to meet our employees where they are, where it was much easier, where, the majority of our employees worked on site. We had on-site fitness, on-site medical, we had on-site mental health counselors, we had on-site nutritionists, that's probably not that model is probably not long-term. It's going to have to be much more flexible. So I would say that having very strong brand recognition and, commitment, and we bring that into into the leadership discussions. And so I think that is a really key thing.
Mhm. And prior to the pandemic, I would have told these bright minds in the audience that corporate America needs their help with figuring out how to help people in the workplace get along. I think we lose a lot of productivity with tension in the workplace. Part of it is because many of these jobs are extremely demanding. Employees don't get to turn them off when they go home. They may take a break, but they're online in the evening. I don't know that it leaves enough time for employees and managers to have substantive conversations on the things that they need to discuss. And in some organizations, I have found that because everyone is so busy, problems that could have been simply addressed go unaddressed, and they end up being larger problems, and you run into disconnected teams, dysfunctional teams. And I think one of the challenges that we have is because most people are stable in their roles, they don't want to leave after they dedicated many years to a particular role. People stay stuck and they're unhappy, and no one's addressing team dysfunction, and morale suffers. And it can be a really big problem in organizations where you have employees that have been long tenured. I don't know I haven't worked at a Google where the workforce is younger. But I think if I were thinking of a solution, what you're studying around team dynamics, how to improve communication and create opportunities for more crucial conversations, it's been important in the past, but it is still very important today.
Yeah, thank you. Those are great points. And it actually ties back, if I can do a shameless plug for a couple of my colleagues at the Carey Business School, in particular on the issue of sleep and the importance of that in terms of good decision making, which Professor Brian Gunya has done some really cutting edge research on that topic. And again, a hard thing to quantify in an organization of a bad decision. And another one of my colleagues, Professor Michael Darden, apparently, I just got a chat on this, has done a study on Sleepio, and some of the other products like it, and found that it was the most cost-effective form of care for helping people overcome poor sleep when compared to alternatives such as pharmacotherapy, group and individual cognitive behavioral therapy as well. So we can certainly make those studies available to you. But I want to turn now to actually, again, Marlise, your comment about team dynamics, and going back to your introductions that you each did of yourselves and your backgrounds. I'm curious, we have already a couple of questions regarding the role and how to best enter into a role such as this and prepare for it. So given what you know now, I guess, in terms of how you would have best prepared maybe for the role, or others could, how important is it to have, management as part of your background, or other training or education that best prepares you for this role?
I don't think it's required, but without it, I think you need to have many years of practice. I think it might have been, actually both Vicki and Lori talked about how we all started at staff roles where we were doing the basics of patient care. And there were other tiers, more senior physicians that we got to study under and learn from. you also need to be in a role that's going to give you some exposure and visibility to what happens outside of the clinic. So one of the most satisfying things about being in the manufacturing environment, and even, I guess, in a corporate office, is the opportunity to get out and walk the floors, understand what the hazards are, look at what people are building or what they're designing and the challenges that they have, not only from a physical standpoint, but are there risks for fatigue or stress. I don't think there's anything that you can do to get to the roles that we are in now without years in the trenches to really, really understand all of the things that can pose a risk to an employee's health and and the relationships. I think many of us feel that we would not be capable of doing what we are able to do if we had not learned to build enduring relationships with people outside of the wellness center.
Yeah, I think, being a physician to be the chief medical officer is pretty much a must. I think there are people who can lead organizations and not be a physician, but there are challenges with that. You don't have the same technical knowledge where there's data privacy issues. You may even have parts of the business you can't even oversee or know about. So it's hard to manage what you don't know at all or can't be told. So it can be complex. But I think, we do see nurse practitioners and nurses doing it. So I think something in health is really important. And then I think, depends on the sector that you're working in. But for me, having a master's in public health was probably the biggest thing that I needed, because you need to understand the difference between taking care of a patient one-to-one, which is what all of us were trained in as internists, and what's called population medicine. So managing groups of people, and how do you make decisions when you're trying to decide how it impacts groups versus a specific individual, and how do you develop programming around that, and a lot of just the basics. And you get some business in most masters in public health degrees will give you some healthcare administration courses in basic business. An MBA would have been fabulous. I've wished I had it many times. I read the Harvard Business Review like every morning. I do whatever I can to read Wall Street Journal. I read religiously. I talk to the people in the business, because one thing, we haven't touched on this, but it's really important to learn how to speak the language of the business you're in. And I can talk doctor stuff all day long and they don't get it. I have to learn their language. And so those are things that having an MBA would have been great. I learned more by the seat of my pants and have done okay. But I don't know, maybe someday I'll come visit you and see if I can sign up for an MBA, because it would be very helpful. And I think probably even more so as time goes on, the expectation is going to be driving cost effectiveness and cost efficiency. And so those are just really important things to have some background in.
So Vicki, before you speak, I just want to add to something that Vicki said. I do think the master's in healthcare management was transformative for me, and feeling more capable with finance and budgets and understanding cost and how they impact some of the decisions that you made on what will be funded or not. And it also gave me a deeper dive into the world of human resources and what do they do in organizational design, and is there an opportunity for health and OD to create more effective, harmonious workplaces. So I think it made all the difference in my career.
So I will only add that I don't have an MBA or an MPH. I think that it would be an absolute asset to have it. I think I probably got on the job training. And I think exactly what Vicki was talking about, from going from individual healthcare to population health, is really very much about the big job of what I do. So I think it's an absolute asset, but I was able to learn it. And there's probably are some flat sides, and I'm lucky I have support in my flat sides to compensate for that.
And you've all talked about population health and the importance of public health. So this year clearly demonstrated the intersection of workplace health and more general public health in the community. And so I'm just kind of curious, as you think about your roles, obviously you think about your employees, but how do you all also think about the communities in which you serve, you are in, your workforces are in, and in particular, the heightened awareness for health equity over this past year. So any thoughts at all on those two topics, the community and health equity?
Yeah, so I think it's a fascinating area that I feel privileged to be involved with our corporation. When we do new business anywhere, there's a lot of assessment that goes into evaluating, the impacts our business could have on the community where we're operating. And we feel strongly that it's important to have a great relationship with our communities where we operate. So we do what's called health impact assessments. We go into the community, and it's kind of a two-way thing. We want to see how the community is going to impact our workers and our workforce, what the healthcare infrastructure is like, so that we know how the employees and the entire workforce can be cared for, and where there may be gaps, because often we go into challenging locations where there may be very limited medical resources, and we have to set up wherever there's a gap so that the workers are well cared for. But then we also will look to see how can we uplift that community. So often we as the medical staff and the CMO will help advise on how we may provide funding through our foundation and things like that, in order to give meaningful donations that will be sustainable and helpful to the health community, the health of that community. So it's a very interesting part of what we do that does go beyond what the sort of traditional scope of occupational medicine would be. But I think it's a reality of business. You really have to care about the community that you're in. And part of that is the impact you're having on them and how you help uplift them.
I think we've all had an opportunity to teach our business colleagues about the social determinants of health. And if you are concerned about the health of your workforce, you have to think about where they live and the dynamics in their family. Are they in safe communities? Are they in places where, if you're encouraging more activity, can they safely walk outside? What genetic predispositions might one ethnic group have versus another? With African Americans, hypertension, obesity, though not genetic, there's certainly a higher incidence in those communities. So if you really want to talk about addressing healthcare in some underrepresented groups, you have to know what the risk factors are. And I think companies are paying a lot more attention to that through their outreach with corporate social responsibility. They understand that it's not only donating to a cause, but it's about rolling up your sleeves, getting in the community, and addressing some of the social challenges that we face as well.
I don't really have anything else to add. I think it's exactly what the role that we're all playing.
That's fine. Thanks, Lori. I do have a question from one of our audience members that will take us sort of from local to global communities, I guess. So the question is the following. You all mentioned working with or on international sites. How do you handle implementation of safety measures or new policies or procedures in countries which have a country culture which is reluctant, or a government which pushes back, or unions, I guess, presumably, that are pushing back? I'm just wondering if you have any experience or stories to share. Anybody has anything to share on that one?
And that's a great, it's a great question because it shows some insight that culture matters. And you do have, kind of like Marlise was saying, you have to understand the culture, you have to understand what life is like in a particular area. And, we have a certain standard. We typically set a minimum standard and we expect that standard. So we don't lower our standard because the legal requirements are lower. We raise the standard to the standard we expect. We do a lot of training. There's a lot of emphasis, particularly our company, because it's very safety conscious. There's a huge focus on safety. People who come onto our sites or working know that from the moment they enter our site. This is a place where you think about safety. And we do have to be conscious that cultures may be different. And we are working with typically a very large percentage of the workforce in any given location is a national workforce. When we go into new areas, there can be quite a bit of training. And I won't get into any kind of stories right now, but there are some interesting differences in the way people do things. And one of the challenges is you can teach them to do something at work, but you have to help them learn that they need to do that when they go home too, because safety doesn't really stop the second you walk out the door, because it's a lot of it's about habit. And so we try to, again, also sort of bring up, these are for you and your family. We want you to learn these things so that everyone in your family is safe. And when you come to work, we continue those things. So those are some of the approaches. And it's a big topic, and it's an area I have a lot of interest in, is just sort of the cultural differences and how they impact, the way we communicate and the way we can be effective. And it's not only with safety, but also with health. There are many, many examples of well-meaning health initiatives that completely ignored the way the local culture viewed whatever it was. So you can spend a lot of money on things that will have zero uptake or impact if you ignore culture. Hand it over to y'all.
If Lori, Marlise, if you don't have anything further to comment, I do have one final question. I know we've only got a couple minutes left. And so this is just a shout out that today is the final day of Women's History Month. And I'm wondering, did we just get really lucky to find three great chief medical directors who happen to be women, or is this what are your experiences from conferences and so on that you attend? Are there a lot of women in roles similar to yours, and do you see any of that changing over time?
I think this is a perfect Lori question.
I would say that for my 30 years, I have typically been the only woman in the room. It's great to be with three really brilliant women in the same, sphere. I think, as we started, I don't think this career path is well known in medical school. I did a similar panel to my, where I went to medical school, and nobody even had heard of, the non-traditional roots of corporate or occupational medicine. So I hope more women go into it. It's a fabulous field. As I said from the beginning, I never am bored. I'm challenged. I'm respected. I feel purposeful. I get up every day, and I really love what I do. So.
I agree. I think we're the best kept secret.
There we go. Well, I'm glad that we were able to shed some light on the role and on the incredible dedication that the three of you have had and impact on your companies. And so I want to thank you, Vicki, Marlise, and Lori, so much for taking the time out from an already incredibly busy schedule to spend with us and to educate us all about the role that you play. So thank you so much.
Thank you.
Thank you. Thank you.
Thank you.
This concludes our program, and I just want to also thank our audience for joining us and for your questions. And we hope to see you again on April 21st. Our next Distinguished Speaker Series presentation will feature Christoph Langar, who is a co-founder of Thrive Early Diagnostics, which is a great Carey and Hopkins entrepreneurial success story. And so he will be our distinguished guest, interviewed by Christy Weiskill, who is heads up Johns Hopkins Technology Ventures. So until then, have a great evening, everyone. Take care.